In this session, we will focus on a medically important flagellate, which is Giardia lamblia. Okay, if you can look at the picture on the left, okay, this is the trophozoite of Giardia lamblia. What are the characteristics that we can appreciate? Okay, we can see the flagella extended out from the parasite body. We can see a sucking disc that help the parasite to move, and also the tear shapes of the trophozoites. A tear shape can be also described as water drop shape. For the classification of flagellates, Giardia lamblia is classified under the subphylum of Mastigophora. So this organism is capable of self-propelled through the motion of one or several flagella. And specifically, Giardia lamblia is under the order of Dipromonadida. So in this order, the organism usually have two nucleus. Okay. And for Trichomonadida, the well-known human pathogen include Trichomonas vaginalis. The others are commensal organisms. Okay, flagellates under Rhytoda and also Enteromonadida. They are usually commensal organisms. The infamous pathogen under Trypanosomanida include Leishmaniasis and Trypanosomiasis. In case of Leishmaniasis, it is usually imported cases in Malaysia due to the influx of immigrant workers from other countries. For Trypanosomiasis are usually associated with animals such as cattle, buffaloes, deer, horses, and pigs. For recall, Entamoeba histolytica and Giardia lamblia is grouped under the phylum of Sarcomastigophora. And Entamoeba is under Sarcodina, which is the movement using pseudopodia. While Giardia lamblia is under the subphylum of Mastigophora, their movement is with the help of flagellas. And Giardia lamblia is the pathogen of human intestines. This is the list of protozoa that we are going to cover in this course. It includes Giardia lamblia that affect the guts, and the major clinical manifestation is malabsorption of nutrients. In this lecture, we will look into the epidemiology, morphology, life cycles, pathogenesis, clinical manifestation, and diagnosis related to Giardia lamblia infections. Okay, Giardia lamblia is first discovered by Leeuwenhoek in 1681, and then Lamb was the first one who described the presence of these parasites. This is the only known flagella that cause endemic and epidemic diarrhea in humans. Every year, about 200 million people get infected, and 500,000 people produce the symptoms of giardiasis. The transmission route include fecal-oral route. However, anal-oral route were also reported among male homosexual practitioners. The disease is particularly of importance among young children with malnutrition. This table tabulates the description of trophozoite and cysts. One of the unique characteristics that help us in identifying both trophozoite and cysts are the presence of nuclei, azostyles, and the parabasal body. The trophozoite is usually present in duodenum and jejunum, while the cysts are usually found in the colon. And the shape of the trophozoite are tear shapes, and the shape of the cysts are in oval. Usually, the cysts are smaller than the trophozoites. The differences between these two life forms include trophozoite is the motile stage. It moves with the 4 pairs of flagella, and trophozoite has also a sucking disc that help in the attachment to the mucosal layer. In terms of nucleus, trophozoite has only a pair of nuclei, while cyst has two pairs of nuclei. In terms of nucleus, both life form has a clear central chromosomes, and the nuclear membrane is delegated. There's no presence of chromatin granules. Okay, Giardia lamblia can complete its life cycle within a host. So during the life cycles, both trophozoite and cyst are excreted into the environment. Okay, both trophozoite and cyst are the diagnostic stage, which means when we do the stool examination, we can find both life form in the stool samples. However, trophozoite is not stable outside the host, so it will disintegrate shortly after being excreted. While the cyst is the infective stage. It is more robust and resistant to environmental stress. So it can circulate into the environment. And humans get infected somehow when we ingested food or water contaminated with the cyst. Upon ingestion, the cyst will undergo excision in the duodenum or jejunum part. One cyst can hatch to form two trophozoites, and the trophozoite will continue to multiply by binary fissions. And when there's a lot of trophozoite, some trophozoite will move to colon, and encystation happens in the colon. So during the encystation, the trophozoite retract the flagella into the exostyles, and the cytoplasm become condensed, and a tough cell wall is formed, then finally lead to the formation of a cyst. The internal structure are doubled as the cyst matures, thus producing two trophozoites when excitation occurs again. Okay, now we look at the pathogenesis process of the infections. After excistations, the protozoan continue to reside in the duodenum or jejunum part of the body. The area are rich with bile, carbohydrates, and has low oxygen tension. The sucking disc facilitate the attachment of the parasite to the mucosal surface, and this lead to the damage on mucosal lining of the small intestine. However, the trophozoite doesn't invade the mucosal tissue. The physical presence of the trophozoite on covering the mucosal layer, and also the formation of several toxic proteins that flatten the microvilli, it disrupts the brush border that are present on the mucosal layer. Thus, if the inflammation continues, it will result in villus atrophy, means the reduction of villus. This will lead to the occurrence of malnutrition. The clinical manifestation of giardiasis include intestinal and extraintestinal symptoms. In duodenitis and jejunitis, the patient may experience diarrhea, malaise, flatulence. In case of malabsorption, the patient may have stercoria, or in another term is greasy stool. The stool is characterized by contain large amount of mucus and fat, but there's absence of blood. So the patient with chronic giardiasis usually will have weight loss, and as a result of malabsorption of fat, carbohydrate, and sugar or vitamin. So in terms of extraintestinal symptoms, it include chronic cholecystitis and jaundice. Sometimes allergic symptoms can occur, but rare. The routine diagnosis of giardiasis involves the examination of the stool. So the routine method include microscopic examination. We can perform saline or iodine stained wet mouse to examine the presence of the trophozoites. In case we want to see clearly the inner structure of the trophozoites, we can perform special stain like trichrome, iron hematoxylin, or Zimsa stain. If the count of the cysts or trophozoite are too low or not found, we can perform concentration stool techniques to increase the yields of the parasites. Stool antigen tests can be performed to detect the parasite protein in the feces. The method include ELISA or immunofluorescent antigen detection test. Other special tests include bowel aspiration or duodenal and jejunal biopsies can be done as well, and the sample can be sent for histological examination to detect the presence of the trophozoites. So the drugs for the treatment of giardiasis are metronidazole. So this is the common drug that we use to treat all anaerobic organisms, which include bacteria, protozoan, Entamoeba histolytica, and Trichomonas species. The dose is usually 250 mg, and we have to take 3 times a day for 5 to 7 days at least. The main side effect of this drug would be metallic taste, nausea, and vomiting. And this drug should be avoided during the first trimester of pregnancy. The prevention method is similar to other fecal oral route transmitted protozoan. For the host, we have to take only safe and clean food. And education has to be provided to people to improve their personal hygiene. We hope that this will reduce the percentage of person-to-person transmissions. For the environment, we can set up water treatment plant and providing basic sanitary system in the endemic area. This will greatly help to break the chain of the life cycles. To counter the pathogen, we have to screen and treat the infected individuals to reduce the number or the size of reservoir for the parasites. These are the images of the cyst and trophozoite of Giardia lamblia. The cyst is in oval shape, suppose, and have 4 nucleus with central exostar body. But in this picture, the shape is a little bit distorted. So what causes these distortions? So this distortion could be happen during sample processing or during the fixation. And we are supposed to see 4 nucleus. However, only 2 are shown here. The other 2 might be at the back of the protozoa. So for the central exostar, we can appreciate the characteristic exostar here. And in iodine stain samples, the samples are directly mixed with the stool samples. So it didn't undergo fixation or staining. So this protozoa it still looks round oval in shape. We can see at least 1, 2, 3 nucleus in this picture and the central exostar body. We might appreciate more the characteristic when we play with the fine focusing of the microscopes. For trichome stain trophozoite, we can appreciate the tear shape or the water drop shape of the trophozoites, and we can see the nucleus here, but the flagella are not seen. And this is a picture of scanning electron microscopes. We can see the flagella extended out from the exostars or the body of the trophozoites, and these are the sucking discs. The nucleus are not seen because the nucleus is inside the sucking disc. For scanning electron microscope, we can only appreciate the surface structure of the trophozoites. Okay, this is the immunostain samples. So the antibody specific to Giardia lamblia make the trophozoite shines. Those antibodies are conjugated with fluorescence. Therefore, for positive sample, we will see clearly shine or glow signals. Okay, that's all for this session. Thank you for your attention.